Further amendments? Mr. Bergner.
Thank you, Mr. Chairman. Amendment 0017.
Mr. Chairman, reserving the right to, reserving point of order.
Gentlelady reserves a point of order. Without objection, the amendment will be considered as read. The gentleman is recognized for 2 minutes to explain this amendment.
And I thank the Chairman. This amendment would create an exemption to Stark anti-kickback laws that currently prevent hospitals and other groups from sharing technology with physicians. Hospitals and doctors' practices are prohibited from contracting with one another for the purposes of technology or software transfer. While recent Health and Human Service regulations allow hospitals to donate equipment to doctors' offices, they're still prohibited from entering into long-term contractual relationships to develop the purposes of maintaining, upgrading equipment and software over time. And any physician's office who's ever gone to electronic medical records will tell you it's not just the cost of the equipment up front, but it's also the cost of training personnel and the cost of maintaining the software over time that is adds to the expense. Providing a narrow exception under the federal antitrust law for the ability of healthcare providers to work off of similar technological platforms makes sound business sense and will improve the adoption of health information technology. Mr. Chairman, recently I attended the Commonwealth Fund symposium that they have every year. We heard from a large medical practice in western Pennsylvania, and they would like very much to be able to put technology in all of their doctors' offices, but they're prohibited from doing so under the Stark laws. As a consequence, they've gone to a web-based portal, but then they get into difficulty with the privacy aspects. So we've really constrained the private sector from moving ahead with technology that we've told them to develop. Coordination in healthcare, we all talk about it, and we say it leads to better health outcomes. And if we're focusing on how greater information technology deployment can revolutionize...
Mr. Chairman, I hate to interrupt my Texas colleague, but could we get a copy of the amendment?
Let's be sure we have the amendment distributed.
Thank you, Mike. I just wanted to read it.
The gentleman, I think, had 20 seconds if you wanted to complete your statement.
Well, I just simply conclude by saying we talk about revolutionizing the practice of medicine with information technology. We should eliminate the legal barriers to greater coordination of care. This is going to be critical. This amendment provides for a narrow exception under a law, and it is cost-free. As we pour money into this sector of the economy, I mean, it is literally raining money today. Our dollar will go so much further if medical practices, hospitals, and clinics can jointly share in the cost of capital of these systems. Now I'll yield back the balance of my time.
Gentleman's time has expired. As I understand it, when Mr. Burgess had an amendment before, the wrong amendment was passed out, and that's this amendment. So we will try to make copies available for members who wish to have copies of this amendment. And
Anything I can do to help the cause?
And Mr. Burgess has offered his personal copy, and he's willing to autograph it. In the meantime, Mr. Pallone, do you seek recognition in opposition to the
Mr. Chairman, I
Yes,
withdraw
Mr.
my
Chairman.
reservation.
Gentlelady withdraws her reservation for a point of order.
Mr. Chairman, if you remember, those of us who've been here a few years, when there was in the Republican majority Congress a few years ago an effort to move an HIT bill through this committee, and the source of funding was basically to loosen the Stark and anti-kickback and anti-fraud protections. I don't believe that that's an effective means of paying or actually producing a good HIT bill. I mean, what we're doing today, and I think it's very significant in the underlying bill, is we're funding HIT through Medicare and Medicaid, and we're actually providing the money up front to do this. We have direct funding for health IT, not these fraud loopholes that essentially have been talked about in the past. And my fear is that you're just, that this is not the proper way to go about it. I think it's important to continue those Stark and anti-kickback and anti-fraud protections, not use them as a way of paying for the bill, particularly now that we have the opportunity with this economic stimulus package to actually pay directly to proceed forward with these great provisions. So I would urge our members to oppose this amendment. Again, it goes back to what the Republican majority was trying to do before, and I think it's not the proper way to proceed when you're trying to really effectively do a good HIT program.
Well, gentlemen,
I would yield to Mr. Waxman, the chairman.
The underlying bill provides billions of dollars to doctors, hospitals, and others to incentivize the adoption of an electronic health record. An electronic health record allows providers to communicate with each other, even with providers across the country. CMS and OIG promulgated appropriately tailored exceptions to the stark anti-kickback laws in 2006. Now, these exemptions permit the donation of health information technology as long as that technology permits electronic communication among recipients. The amendment emphasizes loosening stark anti-kickback, anti-fraud protections. And these exemptions, I think, undermine the connectivity this bill aims to achieve. So I would urge my colleagues to oppose this amendment. Are we ready?
Mr. Chairman?
Yes.
I realize I've used all my time, but
Gentleman's recognized for 30 additional seconds.
well, first off, this bill before us today, no money comes to anyone before 2011, so that's a big problem. There's not a lot of immediacy to this bill. And honestly, this costs nothing, and it's not a question of, it's a question of being able to leverage. We all admit it's raining money right now. There's no stop to the amount of dollars that are being pumped forward. Why not leverage those dollars so they're spent more efficiently? One of the things we could do is define privacy once and for all and not change our minds every 30 minutes. Mr. Rogers tried that. You knocked it down. The other thing we could do is relax some of the regulatory framework. These are 30-year-old laws that have no place in the 21st century.
Gentleman's time has expired. I will elaborate further on that. We are spending $2 billion right away under this bill. We'll now proceed to a vote. How does the gentleman wish to have this vote taken? You want a roll call? Okay, the clerk will call the roll.
Mr. Waxman.
No.
Mr. Waxman, no. Mr. Dingell. No. Mr. Dingell, no. Mr. Markey. No. Mr. Markey, no. Mr. Boucher. Mr. Pallone. No. Mr. Pallone, no. Mr. Gordon. No. Mr. Gordon, no. Mr. Rush. No. Mr. Rush, no. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. No. Mr. Stupak, no. Mr. Engel. Mr. Green. No. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, no. Mr. Barrow. Mr. Barrow, no. Mr. Hill. Mr. Hill, no. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Barton, aye. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Stearns. Mr. Stearns, aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Engel? Mr. Engel votes no.
Any other members wish to be recorded?
Mr. Sarbanes? Mr. Sarbanes votes no.
Have all members responded to the vote? The clerk will tally the vote. and
On
announce
that vote, Mr. Chairman, the ayes were 16, the nays were 32.
it. 16 yeas, 32 noes. The amendment is not agreed to.